Right, so we're going to go through a CAM assessment that we would use to assess any asymmetries or movement quality when assessing the glute max muscles, glute minimus, and then the psoas musculature. So first, again, we do an active comparison, and I would look at the cams as we illustrated it earlier, compare both sides, and I would look actively at neutral, so Matt internally rotate at neutral. I would externally rotate at neutral. Internally rotate with 30 degrees of abduction. Externally rotate at 30 degrees abduction. Actively hold that there, Matt. External rotation with 30 degrees of abduction, as well as internal rotation in the same position. Going through the entire box, again, comparative study, active motion, internal rotation. It hit 30 degrees of hip flexion, external rotation at 30 degrees of hip flexion. Go across into adduction, actively internally rotate Matt, and externally rotate. I'd assess that bilaterally, actively. Go to your stomach, Matt. I'd also put him prone, again, do an active comparison, hip neutral. I'd have him flex his knee to 90 degrees, actively internally rotate. Active external rotation. Again, active bilateral comparison, see where there was a restriction or movement asymmetry. And then I would look in prone, have him lift his leg up off the table actively, so extend your hip, Matt, with the hip neutral. I'd have him internally rotate and lift, Matt, actively. And then externally rotate and lift into hip extension. Again, actively comparing both sides for a CAM evaluation. Go to your, let's go to your back here, Matt. Excuse me, look, I guess while he's here, we'll go to glute minimus first. So the glute minimus, what we're gonna do is we're gonna take him into 30 degrees of hip flexion and abduction. For the anterior fibers, we're gonna have him internally rotate. Hold that, Matt. We're gonna push into adduction. Hold. Hold. Good. Comparative look here. Flex the hip to 30. Internally rotate. Push into adduction. Look for any weakness there. For treatment, go to your side here. This side. Oh, this side. We'll go to this side. So we're gonna look for glute minimus. Off the crest of the hip, we're gonna go down lower on the anterior fibers and cross here, and then go off the anterior aspect of the greater trochanter and DFAMAT. Go through your DFAMATs there. Okay. For a PIC, we do 6 contractions of 10-second holds. Again, internally rotating. Relax there for a second. Okay, then hold for 6 seconds. And we repeat that PIC 6 times for 10-second holds. For glute med posterior fibers, for assessment, again, we're going to abduct 30, flex the hip 30 degrees, okay? And then push into adduction, hold. Okay, externally rotate fully, hold that there. Don't move, push. Good. Again, do that assessment bilaterally. Abduct 30, hip flexion 30, okay? And then push. Good. Push. Again, for our DFAMAT there, we'll go sideline again.
This is glute mid.
Oh, glute mid, that's what.
Yeah, I think you said mid by accident.
Oh, so glute minimus. So we'll go the posterior fibers or lateral fibers, iliac crest here, drop down more on that posterior lateral aspect into the greater trochanter, more posterior and lateral, and do your DFAMATs, followed by your PIC for the glute min. We're going to abduct, externally rotate, and then I want you to relax there, Matt. Okay, now hold, push into that, 10%, contraction, 6 times, 10-second holds, and repeat that bilaterally, or excuse me, with the PIC 6 times for 10-second holds for resetting. So if we go to the stomach next, we'll go glute max. So the glute max, we're going to go through our assessment here. We got the ilio fibers, the sacral fibers, and then the coccygeal fibers. So for the ilio fibers, we're going to bend the knee to 90 degrees. We're going to externally rotate his leg. Now I want you to actively extend your leg in this position, hold there, and then hold, relax, pretty weak there. Again, lift, and push, good. So and we do a bilateral study. Look, externally rotate, lift, hold, good. So for our DFAMATs on the iliofibers, find PSIS, iliac crest, coming on that posterior aspect of the ilium. And then find the greater trochanter, come about 2 inches down on that gluteal line. As well as the lateral femoral condyle. And then off Gerdy's tubercle, where the IT band attaches between the fibular head and the tibial tuberosity. Good. And we do that bilaterally, or wherever the weakness existed. And then for our PICs, externally rotate, hip flex or knee flex to 90 degrees. We're gonna lift, okay? And then Matt, I just relax that leg. Just relax. Now I just want you to unweight your leg from my hand into extension. Go ahead. Hold for 6 seconds. Or hold for 10 seconds, repeat 6 contractions. Good. And repeat that the number of times for our PICs for the 6 contractions. Okay, so that's the iliofibers, the sacral fibers. We are going to stay hip neutral with the knee flexed. Okay. Now, Matt, I want you just to extend your hip from the table. Okay, hold right there and push straight down. Good, hips abducted as well, relax. So abduction, hip extension, and hold. Good. For our DFAMATs, we'll come down off that ILA or the lateral sacral border. Again, comparison on strength on both sides. Come down on the ILA. That sacral border. Not quite as low as the coccyx. Coming down on that gluteal line. 2 inches distally and posterior lateral to the greater trochanter. Again, lateral femoral condyle. And off Gerdy's tubercle between the fibular head and tibial tuberosity. Good. Then for our PICs, we'll stay slightly abducted, hip neutral, extend the leg. Now relax, Matt, right there. Okay, now I just want you to unweight your leg from my hands. Repeat 6 times, hold 10-second contractions. Relax. Repeat that 6 times for your PIC. Now for the coccygeal portion of the glute max, we're going to test with hip adducted, internally rotated, so hip adduction, slide adduction, hip internal rotation. Have Matt extend his hip here, and then hold, relax, try to get internal rotation, slight hip adduction, extend, hold, pretty weak. Again, compared to the other side. For our DFAMATs, we're going to come low off the ILA into the coccyx. And again, we'll come off on the greater trochanter, come distal to the inferior or the gluteal line. Lateral femoral condyle. Gerdy's tubercle. And then for our PICs, adduct the leg, internally rotate, hip extension. Hold that, just relax that right there, Matt. Now try to unweight your leg from my hand, lift, relax. Hold, no, relax there. Now hold and lift off my hand, just 10% contraction. Repeat 6 times, 10-second holds. Okay, and again, repeat those. Now take care of the glute max. Let's go to your stomach, or your back, Matt, excuse me. We'll look at the Psoas complex. This really varies strictly off of the level of hip flexion that you place the patient into. So for the lumbar fibers, we're going to take the 45 degrees abduction, 30 degrees of abduction, 45 degrees of hip flexion, and fully externally rotated. Hold that right there, Matt. Okay, hold. And hold. Hold. Good. We're going to do a comparative study, so we do look at that bilaterally. And then for our DFAMATs, we're going to do the lumbar fibers, so come off the iliac crest. We're going to flex the knee and kind of externally rotate. Start at the lumbar bodies and transverse process of L2 through L5. Crossed, 45. Relax your breathing. So. Okay. And then we'll come down to the lesser trochanter of the hip. And then for our PICs, we'd take the 30 degrees abduction, 45 degrees of hip flexion, fully externally rotated. And just relax there a minute, man. Okay. Now lift and hold. Relax. 6 contractions, 10-second holds. Lift from my hand gently. Hold. 10% contraction again for all our PICs. Repeat that 6 times. So we're going to go the thoracic fibers. So T12 to L1. We're going to change our level of hip flexion to 30 degrees versus 45. And we're going to externally rotate and abduct to 30 degrees. And we're going to hold right there, Matt. Hold. Relax. Hold. Again, comparative look to the other side. Hip and knee flexed again. We're gonna go a little higher, so off the iliac crest up to that T12, L1 lumbar bodies. And then down to the lesser trochanter for our DFAMATs. Our PICs again are going to change only with 30 degrees abduction, external rotation, 30 degrees of hip flexion, and hold. 10% contraction. Relax. Repeat 6 times for 10-second holds. Okay. For the diaphragmatic fibers of the Psoas complex, we're really going to just go 10 degrees. We're going to go abduction, 30 degrees, fully externally rotated, and then 10 degrees of hip flexion. Hold right there, Matt. Hold. Hold. Again, comparing to the other side. For our DFAMAT, find the rib cage, floating ridge, xiphoid process here. We can come on the other side. Exhale fully. So under the rib cage from the xiphoid process to the lower rib cage. And again, into the lesser trochanter of the hip. And our PICs will be performed in 30 degrees abduction, fully externally rotated, hip flex to 10 degrees, and then just lift from my hand mat and hold. Six times, 10-second holds, relax, and you repeat that 6 times for your PIC. Okay, good.